Inflammatory bowel disease, or IBD, affects millions of people worldwide. But what exactly is it? Let's find out. This is Medscience Simplified. I am Dr. Zikky. Inflammatory bowel disease, or the short form IBD, is a term that describes two chronic conditions, Crohn's disease and ulcerative colitis. They both cause long-term inflammation and ulcers of the intestines. Crohn's disease can affect any part of the digestive tract from the mouth to the anus. However, it most commonly affects the small intestine and the upper part of the large intestine. Ulcerative colitis, on the other hand, affects only the large intestine, which includes the colon and the rectum. How common is IBD? It is a widespread condition affecting up to 3 million Americans and a lot more worldwide. It affects all ages and genders. However, it is often diagnosed between 15 and 30 years of age. How does inflammatory bowel disease relate to irritable bowel syndrome? I get this question a lot. Many confuse inflammatory bowel disease, IBD, with irritable bowel syndrome, IBS, which is also known as spastic colon. Let's clarify this. While both IBD and IBS affect the digestive system and may have a few overlapping symptoms, the complications and treatments differ significantly. Inflammatory bowel disease, IBD, is an actual disease process. It is characterized by chronic inflammation of the intestines. Irritable bowel syndrome, on the other hand, is a syndrome, which means a group of symptoms. It is a functional disorder that commonly affects the frequency of your bowel movements. Increased bowel movements result in diarrhea, cramping, or decreased bowel movements resulting in constipation and gasiness. IBD causes intestinal inflammation and damage, and actual damage. It increases your risk for intestinal cancer and can be diagnosed by imaging scans because of the damage it does to the bowel. IBS, on the other hand, does not cause inflammation or damage to the intestines. As a result, it is undetectable by imaging scans. IBS also does not increase your risk for intestinal cancer. The causes of both IBD and IBS are unknown. Treatment for IBS is usually lifestyle modifications such as improved sleep, diet changes, stress management. Treatment for IBD also involves lifestyle modifications. However, it is more commonly treated with medications and on rare occasions, surgery. Can I have both IBD and IBS? The answer is yes. Absolutely, you can have both IBD and IBS at the same time. However, there is no evidence that having IBS increases your risk for having IBD. Now, this talk is about inflammatory bowel disease, IBD, so let's refocus. What are some risk factors for IBD? The exact cause for IBD is unknown, but some risk factors include age. IBD typically develops before age of 30, but can manifest in the 50s and 60s. Race or ethnicity. IBD is more prevalent in whites, but increasing across all races and ethnicities over time. Family history. Having a family member, a close relative with IBD, puts you at a higher risk. Cigarette smoking is a significant controllable risk factor for Crohn's disease specifically, and quitting can improve your overall digestive health. Non-steroidal anti-inflammatory drugs, NSAIDs like ibuprofen and naproxen, may raise your risk or exacerbate existing ones. What are some symptoms of IBD? IBD has a wide array of symptoms, but common ones include abdominal pain and cramping, diarrhea and constipation, gasiness and bloating, reduced appetite, unintended weight loss, mucus or blood in your stool. How do you diagnose IBD? There is no single test for diagnosing IBD. The diagnosis is usually a combination of tests, including blood tests to detect inflammation, diagnostic procedures and examinations like endoscopy, colonoscopy, ultrasound, CT, and MRI. How do you treat and manage IBD? Treatment for IBD varies and includes lifestyle changes, like we have already talked about, but I wanted to re-emphasize to stop smoking if you do. I know it's easier said than done, but the overall health benefits, even beyond IBD, is significant. Medications like anti-inflammatory meds, steroids, immunosuppressants can be used to reduce inflammation and control pain. Severe cases of IBD may require surgery, which involves removal of a section of the intestine. When do I see my doctor? You should see your doctor if you experience extreme abdominal pain, change in your bowel habits, fever and signs of infection, IBD flare-up, or signs of dehydration. Living with inflammatory bowel disease is indeed a lifelong journey that requires resilience and perseverance. With the right combination of treatment tailored to individual needs and strong support system that includes healthcare providers, family, and peer groups, those living with IBD can maintain a fulfilling quality of life. It's about managing the condition day by day, embracing the support that's available, and holding on to hope for the advancements in care that continues to improve the life of those affected by IBD. Thanks for listening. I'll see you in the next video. Don't forget to subscribe if you like this content and want to hear similar content or to support a growing YouTube channel.